I'm Dr. Anil Mishra, Director of Cardiology at Birla Heart Research Center, Kolkata. There is a common myth that after having a pacemaker implanted, your life becomes severely restricted. But that is not true at all. If you see the restrictions, which are very few in the initial few weeks of implant, are there, which means you do not have to put water on the area where you have implanted the pacemaker. You do not want vigorous movement in that area. You do not want vigorous exercise in that area. This is basically to allow the wound to heal safely and not to dislodge the lead, which takes some time to settle in and mature. However, beyond that period of few weeks to few months, 2-3 months, you are really allowed to do most activities very freely. You are able to do all the normal activities, normal exercises. Even you can go for swimming or driving after first few months. You could lead a normal life in the household, which means people often say that you can't handle the switch or something. They can handle all electrical switches, they can handle microwave, they can handle TV, they can handle remotes. You can handle everything what is required in day-to-day activity. There are very few restrictions which have to be really spelled out. One is you have to avoid a strong magnetic field because that can affect your pacemaker. So you don't go near very high power transformers like 25,000 volt transformer. You keep a distance of 6 feet or more beyond that so that it's not affecting that. Also, you have to be careful in your airport when you go through the magnetic doors for security. Just tell them that you have a pacemaker or have a proof that you have a pacemaker available so that they can check you in a slightly different way. Though if you pass through them, nothing happens to the pacemaker generally. Also, you have to be careful about your cell phones. You don't want to keep your cell phone very too close to the device which is implanted on the same side. Therefore, you want to keep a distance of at least 6 inches or more between your cell phone and this. So maybe it's better to use the cell phone on the opposite side where the pacemaker is implanted. Be careful about your headphones as well so that they are not very close to your pacemaker devices. And of course, somebody who smokes e-cigarettes, they have to avoid keeping it close to the device. And don't keep your cell phone pocket, which is on the same side as the pacemaker. So cell phones are to be kept in a different pocket. These are the few steps you have to take to be precautious about it. These are the few restrictions. Otherwise, you can lead an absolutely normal life, and the life expectancy of a person who has a pacemaker implanted is the same as people who do not have pacemaker implanted. So nothing to worry about. It is absolutely nice to have a pacemaker if you require it and lead a normal life without any restriction except the magnetic field related ones.